nation's premier source on health, beauty, and wellness. Detroit Nation with Dr. V. Elaine Arterberry. Lifestyle driven.
For Detroit Nation, bringing you the latest in beauty, health, and wellness. You have to forgive me today. I have a little bit of a cold, but I'm here today with the good doctor who I'm sure can help me. Dr. SHAUNA DIGGS, dermatologist, entrepreneur, regent from the University of Michigan, a graduate of University of Michigan Medical School like myself. Go Blue,
Yay,
SHAUNA.
go
I am
Blue.
so glad you're here today. I'm absolutely delighted to be talking about beauty, health, wellness with you here in Detroit, because nobody thinks Detroit is a place for beauty, health, and wellness, but I know you know that's different. So tell me a little bit about yourself. Really tell me about, I know all about you, but tell me a little bit about yourself for our listening audience.
Well, thank you so much for having me today. I really appreciate the invitation. I'm a dermatologist in private practice. I love what I do. So I see patients all day for medical reasons, acne, eczema, lupus.
The whole gambit.
The whole
right.
gamut, but I also do cosmetic procedures and laser procedures. I do laser hair removal, laser tattoo removal. I do fillers such as Restylane, Juvederm.
Is that for the wrinkles?
It is. It's for the wrinkles. It works wonderfully.
Does it work?
It does.
Now, how long do the wrinkles stay away?
It varies depending on the product, but it can be anywhere from 4 months to 2 years.
Right.
It's really, they're fabulous.
So tell me a little bit about your background. I want our audience to hear.
Mm-hmm. So I attended University of Michigan, my favorite school.
Are you a triple threat?
I am. So I attended Michigan for college, for medical school, and for my residency and internships. I actually was in a 7-year program where you do college and med school combined. So
like
I did,
Ben Carson.
just like Ben Carson.
Oh,
so I
wow,
did like
yeah.
2.5 years of undergraduate work and then 4.5 years of medical school.
Wow.
And then did my internship in internal medicine at U of M,
Okay.
and then my dermatology residency for 3 years at U of M. So I was there for 11 years.
Oh, wow.
Quite a commitment, but I loved every minute of it.
And now you're a regent at the University of Michigan. How does that feel?
Yes. It was really interesting to leave, and do the rest
Right.
of your life. Marriage, children, worked for someone for 8 years and opened my own practice where I've been now for 12 years. And then to go back, as a regent, we run for office. It's a statewide elected
okay.
position. So
So
I
it's
had
not
to actually
appointed.
be on the ballot. No.
Oh,
I
well,
had-
like running for mayor?
I did. I had to campaign around the state. So I would have
Oh,
clinic
that's
all
right.
day and then
Yeah.
drive to Kalamazoo at night, speak to people, drive home, have clinic the next
Oh,
day,
wow. Okay.
drive to Brighton, drive all
Wow.
over the state. But it was a great experience to explain why we need to spend time, effort, and money on our universities and our educational system in the state.
Right. Well, one of our goals here at Detroit Nation is to feature people who are from Detroit who are impacting the nation, and that certainly is you. The University of Michigan impacts the whole world. So you like it? You enjoy doing it?
I love it. I love it. It's a real commitment of time and effort. I love every minute of it.
Are you the
this-
chair of the board?
Yes, I'm chair.
Oh, wow, you're
this
so
year.
young. Oh, my goodness.
As of July 1st, our chairmanship rotates, and I'm the chair this year. So obviously we have issues that we deal with on a daily basis, but we also have things that we focus on for the year. And then, of course, the things that come up during the year.
Right.
So I work intimately with the executive officers, with the president, and with the students. I'm meeting with the president of the Student Government Association,
Oh, wow.
I think next week, to talk about issues that the students would like to see change in the university.
I think that's fabulous. You are such a busy woman. I don't know how you have time for everything. So I want to get back a little bit to the beauty and health. You talked about doing cosmetic dermatology and then some sort of surgical laser-like procedures. What do you like best? Do you like the cosmetic part, or do you like the technical or the skin diseases part about what you do?
I like both. One of the things I love about dermatology is the diversity that I'm able to have, so that each day, each patient, something's different that pops in my office. And I do view all of it as being skin health. So,
Right.
your show, skin, health, wellness, beauty. It is all health to me. It's not cosmetic.
Right.
So, if we try to keep our heart young and healthy, we don't call it cosmetic heart.
Right,
medicine.
exactly.
Right. So to me, keeping our skin as youthful and as natural as possible is health.
So what can you tell women and men, because a lot of men are really into their skin now, about how to best take care of the skin? Is it about cleaning? Is it about the products? What is it that really will give you that beautiful glowing skin?
I think there's some basic things we can do every day which are meaningful. So obviously cleaning your skin and picking the product that's right for your skin type, oily, dry, etc.
Right.
And then using a moisturizer with a sunscreen. The sunscreen is probably the most important thing for all of us because the radiation of the sun breaks down our skin cells over time, over 40, 50,
Right.
80 years. So if we use sunscreen every day, it goes a long way towards preventing that. And then finding some antioxidant creams or vitamin A creams or glycolic creams, something that you like so that you can be really good at using it every day
Right.
and not fall off the wagon.
It's the consistency, isn't it?
It is. It's consistency. So if you pick a routine that's easy, that matches your skin type, and that you like to use every day, you'll be consistent for 40 years, and your skin will look as
And
if
your
you
skin
were
will show it.
10, 20, or 30 instead of
That,
50, 60, or
that
70.
is really important. And you talk about sunscreen, and a lot of African Americans, because they tend to be brown, think they don't need sunscreen. Like, you know, we have a saying that black don't crack, right? Like, we don't get wrinkles. But is that true?
It's true to some extent because the melanin in our skin does protect us.
It protects us from the sun's
It
radiation.
protects
Okay.
us from the sun radiation, but everything is a matter of degree. And so we all can see our parents, our aunts and uncles changing over time.
Right.
So everything's a matter of degree. You may change 10 or 20 years later, but if you use a sunscreen every day, you may change that to 40 or 50 years later.
Right, exactly. So what about their body skin? What can people talk about, you know, it's your face. What's important? Is it the face, the neck, or the body? Which should you concentrate on?
I think all three.
Oh, that's a lot of work.
And interestingly, even as a dermatologist, it can be difficult to sort of see how fast time passes. So years ago, when I began using sunscreen on a regular basis, which was in probably my 20s, I oftentimes did not apply it to my neck or my chest, or if
Right.
I was using a retinoid or vitamin A cream, I
Right.
would put it to my face, but not to my neck or my chest.
Right.
And as time has gone on, I see that my
You're
face
seeing
looks
the
more useful
results than your neck?
Right,
Oh,
my
so it's
face
important
looks
to get
different
that
than my neck
cream
and chest.
all the way down.
Exactly. You should treat all the areas, tops of your hands, your forearms. If you're in
Oh,
the sun in a
wow.
swimsuit, you want to treat everything. So it's better to treat the entire skin, which is the largest organ in our body, instead of
Right.
just picking one area.
Well, they say for women that the fastest way you can tell a woman's age is in her hands.
Absolutely. But if I put vitamin A cream to my hands every day and antioxidants and sunscreens, then I can
You can
change
reverse
that.
it. You can
can
pull it
change
back a
that,
little
yes,
bit.
yeah.
Everybody's trying to pull back a few
Yes,
years.
I
Okay.
absolutely do that.
Yeah, let's pull back the curtain. Okay, go back. So we talk. We're going to take a quick break, and then we'll be right back.
Detroit Nation with Dr. V. Elaine Arterberry, driving the nation to health, beauty, and wellness.
Drivers of Change, showcasing to the world the innovators from Detroit, Michigan, and the nation that are shaping the country. Welcome back, Detroit Nation. I'm here with entrepreneur, dermatologist, SHAUNA DIGGS, and, by the way, in her free time, is a regent at the University of Michigan. Welcome back, SHAUNA. Today's driver of change I picked just for you. Howard, you and me, okay, because he trained at UCLA.
Yeah.
But Howard Murad is a living visionary for dermatology. He is a scientific innovator, a founder of the inclusive health movement, and focuses on a total body approach to youth building and overall wellness. Murad was really most famous for his development of glycolic acid products. He was the first one to talk about using alpha hydroxy acids and glycolic acids to help reverse the skin, and the first one to talk about aging. And really, what I've heard is one of the first people to develop a line of products that almost gave you the results of surgery. He is known as the father of internal skin care, being an originator of the use of dietary supplements to promote skin health, and the pioneer. He's also a trained pharmacist. So for that, he's today's driver of change. SHAUNA, what do you think about Dr. Murad? I'm sure he's an icon in the dermatology world.
He is, and he's a wonderful representation of what we spoke about earlier, which is that skin health is important, keeping your skin as youthful and natural as possible. And you can do that by taking care of your internal health with vitamins, oral antioxidant therapy, and you can also take care of that by using topical antioxidants or topical
So you got to take it on the
exfoliants.
inside as well as the
So I
outside?
take a multivitamin every day. I try and watch what I eat green leafy vegetables, decrease refined sugars. All of those things will also help your skin
Does
appear
it
more
show
beautiful.
up on your skin?
Absolutely.
Like
Absolutely.
how? Well, you do it all the time. But for people that you say you put on a regimen, how long does it take before, if they eat a lot of vegetables, before you start to see it? A week, 2 weeks?
No, I think it would be more in the months, 4 to 6
In a month?
months.
Okay.
4 to 6 months.
But you still see it.
But it is something that you really see over time. So the way I usually think about it is all the things that I've been doing for the last 30 years now are things that I may not see the change day to day, but what I often see is that as my friends are progressing, I'm not progressing as quickly. And that's just as good. It just takes longer to
You're slowing it down.
appreciate.
You're
Right.
slowing it down.
Exactly.
The process. Well, what do you think about the sort of rapid use of injectables, Botox? It's not new. Is there anything new? Is there anything that's going to be as good as those products?
No, those products are being improved. So we're finding
Okay.
things that are more natural, that last longer, that also some of the fillers that we have today will encourage your own skin to produce its own collagen. And they think that's by stretching the fibroblasts or collagen producing cells in the skin. So there's a lot of research being done to show that these things prevent you from damaging your skin or your skin breaking down over time, and encourage your own body to produce
So
collagen.
it's not, instead of just being a filler, it actually tricks your body into repairing?
Exactly.
Wow.
So many of these things are things we could use on a regular basis in small amounts. So amounts you may not necessarily see a difference when you're looking at your skin, but they absolutely will change your skin over time. So things like the neuromodulators like Botox and Dysport. Dysport's a product that if you inject it into the muscles in your skin, it makes them relax. And you don't have to relax 100%. You can
Right.
relax 30%.
And get rid of that little wrinkle, right?
Exactly. And then make you less likely to get those permalines, as I call them, on your forehead or
Right.
your brow over time.
Oh my goodness, I think that's wonderful. What do you think about retinols? Do you think which is a vitamin A? Tell me what a retinol is.
Yeah, so retinols, tazarotene, tretinoin, these are all words that describe vitamin A creams.
Okay.
And vitamin A creams are, I believe, the number 2 thing after sunscreens that you should be applying to your skin.
Oh wow.
And so
Okay.
I've used a retinoid or vitamin A cream now since 1991.
Okay.
Almost every day. I put one on this morning.
Okay.
And so they make your skin exfoliate, so you always have fresh cells. So normally your skin cells may take 28 days to come up and peel off.
Right.
When you're on a retinoid, it may take 12. So your
Oh,
skin's
so you're
always
getting new
fresh
skin.
and new all the time. So it peels off dark spots, peels off acne, and also stimulates your body to produce collagen. So it helps that fine texture wrinkling on your skin.
Right. Is it really that some people argue that initially, particularly when the glycolics came out, that it was that they just caused trauma? And so the trauma, like anything, caused the skin to repair, but didn't really offer a long-term benefit. What do you think now?
No, we absolutely know that they will actually turn on the signaling that starts collagen production. So,
Right.
But many of the different procedures that we have work through wound healing. So you create a subtle wound injury like dermabrasion.
Right. People
Right.
talk about using dermabrasion, which is to take that top layer
Yeah,
off.
so a
and then-
subtle wound injury to your skin, and then your skin starts that repair process and creates new collagen. So, but vitamin A's and glycolic creams, I also use a glycolic every day. I use a 15% every other day.
Every
to my
other day,
skin,
yeah.
to my face, neck, and chest. And same thing, it makes you exfoliate, peels your skin, produces collagen through a different mechanism than the vitamin A. So by using both, you get a better result than if you use just one or the
So
other.
you might want to alternate between a glycolic and a retin A product. Have you seen these things that look like needles? It looks like a rolling pin
Yes.
with needles for the skin. I tried that. Oh my God, I caused all this scarring. Did I do it too deep?
I think too deeply. I've looked at the research for that, and it does work. Again, it's a subtle injury.
It's like a wound, a
It's
little bitty
it's a little
wound.
wound. And I think it's about picking the right procedure for your skin. So that can be a glycolic or a different type of acidic peel.
Right.
It can be the microneedling. It can be microdermabrasion. It can be lasers. And so, especially for us, for people of color, we may need to choose something that's less likely to cause pigment change while
Right.
it's increasing the collagen production.
Well, dark spots are, a woman, certainly for her face, are the big nemesis. What can you tell women to do about dark spots?
Well, all the things we've mentioned already, vitamin A creams and glycolics can help peel off the dark spots, but then you can add a bleaching cream,
Right.
which is hydroquinone. And there are hydroquinones over the counter such as the Ambi 2%.
Right. Is that enough? Do you need?
It does work, but you can get 4% prescription, and many
Okay.
times they're not covered by insurance, but they can run anywhere between $25 and $120, depending on what pharmacy you go
Wow.
to.
Okay. But is it worth it to get? Is that the fastest way to get rid of the spots?
I always have a bleaching cream on my countertop.
No, stop.
I always have a bleaching cream, so I can use it if I need it. But while I'm using that periodically, I'm using my vitamin A and glycolic and antioxidants
Do you
every
think that
day.
helps if you use the Ambi-like product and then you add your glycolic and vitamin A? Does it help it work a little faster?
Using both is better.
Okay.
There actually is a prescription product that has 3 components in it all
Really?
at once.
What's in it?
It has a bleaching cream, hydroquinone. It has a retin A, and it has very, very low level hydrocortisone. But it runs about $350.
Are you kidding? What's it called?
It's called Triluma.
Okay.
It's been out for probably 18, 15 years, and it's a great, great product. So I believe it's worth the money. But you can also take those things and independently use them.
Right, and get the same
stretch
result
them out a little
without
bit.
spending the $300.
Yes.
I understand that you work with teenage girls to talk about skin, health, and hair. Tell me a little bit about that.
I love doing that because I think, in part, we do worry so much about our looks.
Oh, yeah.
And that's particularly worse when you're an adolescent. So anything we can do to allow adolescent girls to talk about it and decide, is this really something I should worry about or not, is worth it. But also just to be a role model. So one is information, giving them
Right.
information. And
Exactly.
two is being that person who they can look up to and try to explore whether they'd like to be a physician like yourself, and I think that's
Well,
really
it must
important
be
for us.
really gratifying because, acne can really wreck with people's self-esteem, particularly when you're younger. People are so, it's so interesting how people are cruel about have you see that in your practice where people kind of transform, where they come to you, get treated for acne, and it improves their self-esteem?
Oh, absolutely. Especially for teenage girls, they'll look down the whole time they're talking to
Really?
you.
They won't look you in the
pick
eye?
at their skin, and then by the time they've gone through a 4-month experience using the medications, they're looking up, they're dressing differently, they're more pleasant. It's
Oh.
really wonderful to see. And the other time you see that is with hair loss. So I see a lot of hair loss or alopecia in the office.
Right.
And that's another issue for teenage girls and for adult
Really?
women where we struggle with our hair.
The young girls are losing their hair?
Yes, yes.
What's the cause? Do we know?
Yes, well, now we used to think that relaxers were a cause, but the current research that's coming out of Duke University and a couple of other centers shows that it's probably more traction
From
or
the braiding
pulling from
and too tight. The braids are being too tight, and the weight of extensions.
Yes, and so part of the visit is using medication to treat the alopecia or hair loss, but also talking about hair maintenance practices that are safer for us so that we won't have long-term hair loss. But it becomes more permanent with scarring.
So over time, people can, if you catch it early, you can reverse some, even if you've pulled a little bit too hard and broken
Yes,
off a few roots.
Absolutely.
Oh, I didn't realize it was that hard. We're going to take a 1-minute break. Actually, not that long.
Detroit Nation with Dr. V. Elaine Arterberry, driving the nation with health, beauty, and wellness.
Shauna, I'm back. This is Dr. Elaine Arterberry with SHAUNA DIGGS, entrepreneur, regent, and dermatologist. We're here talking about tips on beauty, health, and wellness. It's at this point in the broadcast that we call it our lifestyle-driven moment, Shauna, where we talk about really trying to find out from you, the expert, what's the one secret that you want to tell men and women, actually, and probably more women, about how to maintain their health, beauty, or wellness?
Well, over the years, I have become more proponent of relaxation and stress management. And that probably isn't the one people thought I would pick, but I think it's very important for all the organs of the body, for everything, to try to relax and put an amount of relaxation and pleasure in your life. Right. It absolutely affects your face in terms of the lines that you get on your forehead.
You can see it on your face if you do a little yoga?
Yes, yoga is wonderful. But your forehead lines, frown lines, crow's feet lines, the changes that happen around our mouth as the corners of our lips start to turn down, but also affecting our energy level, affecting our propensity for disease, our ability to fight disease. I think that's a big piece of the puzzle.
Oh, I think that's great, and I think people absolutely need to reduce stress. As a dermatologist, when you look at people, can you tell sort of the state of their health just by looking at them to some extent?
Yes, and interestingly, many times it has to do with the color of your skin, and that's not the brown in our skin. It's more the pallor, that sort of blue-gray color. So oftentimes I have patients who are fighting very severe disease, such as cancers, internal cancers that may be spreading or metastasizing. And many times I can tell by their energy level and their color of their skin how they are doing fighting that systemic or internal disease.
Oh, wow. That's really interesting. Can you diagnose certain diseases through the skin?
Oh, absolutely. I had an attending physician at University of Michigan. He used to say that the skin is the window to the soul.
Oh, absolutely.
And I completely believe that. So there are many systemic diseases that have signs on the top of the skin.
Oh, wow. That's interesting. I want to talk a little bit. You brought some products. We're not live on Periscope today, but I want to talk a little bit about some of the things you brought and your own skincare line. How did that come about?
Well, I have always carried skincare lines in my office.
Oh,
Some
okay.
that I think are wonderful.
Other people's lines.
Other people's lines, like Skin Medica, a couple of different ones. They're excellent. But it became very difficult for patients to understand what product was best for them. I had a line for sensitive skin, a line for more intense rejuvenation, a line for this, a line for that. So I decided about 8 years ago that I would start working on a line where people could very easily decide what was best for them. And this line has in it antioxidants, retinols, glycolic acids. And the antioxidants will include green tea, vitamins A, C, and E, coenzyme Q10, hyaluronic acid, and caffeine. And so
caffeine for the skin?
It actually shrinks up the blood vessels so that you don't have that blue color underneath your eyes.
Oh, really?
Yeah, so
it works for the dark circles. I need that. Where's that one?
And it also helps this one. It also helps patients who have rosacea.
Okay.
And so it's actually very good. The things I brought in today are the things that I used this morning.
Okay, so let's talk about what you did this morning.
So this morning I washed my face with a cleanser that's very gentle because I use a lot of strong products. I use a very gentle cleanser.
I wish you guys could see it. This is this beautiful gray, like silvery tube. It's kind of cool. Okay, so tell me about the cleanser.
And so this cleanser has in it some hyaluronic acid. It has some caffeine, and it has resveratrol, which is what's in red wine, one of the antioxidants in red wine.
So it's like putting red wine in your face?
Yeah, it tries to calm your
How's
skin
that work?
down.
Can you drink
really
it?
Good.
Can you drink this one?
And then after I cleanse my face, I put on my rejuvenating eye cream, which helps the circles around my eyes. I use it twice a day. And then I put on a very, very rich antioxidant cream. And I have 5 antioxidant creams in the line.
Are you
They vary
wow.
by their thickness and also by their concentration of antioxidants. So this one looks quite brown or orangey, like carrots.
It looks like an orange, like carrots, yeah.
When you put it on, but it's very silky, and it has a high concentration of hyaluronic acid, which is the jello in our skin. And so it tries to help our skin look smoother.
And I heard hyaluronic acid also attracts water to the skin.
It does.
It helps hydrate the skin.
1,000 times its weight in water.
Oh, so wow.
So
So it's like a sponge for your skin, for water.
So the hyaluronic acid that's in this dermal antioxidant therapy is the same
I like
thing
this.
that is in some of the fillers. So Restylane, Perlane, Juvederm Ultra, Juvederm Ultra Plus all have in them hyaluronic acid.
I wish you could feel I'm putting it on my hands because, like I said, the hands are the window to the soul. I wish you could see the wrinkles coming off my hands as I'm stopping using this product. Okay, so tell me what else you use.
And then
because your skin is beautiful. I'm like trying to figure out what she did this morning.
This final one is my rejuvenating glycolic complex. It's a 15%, which is quite strong.
Right.
And so I apply this every other day, a very small amount. So this jar usually lasts people 3, 4, 5 months.
Are you kidding? Oh,
a little goes a long way.
A little goes a long way.
It's really hydrating. But I start out with a 10% that I used every other day, and I used that probably 5 or 6 years, and then I increased to the 15% about 2 years ago, and then I also have a 20%. So I have friends who use a 20% twice a day.
They can take it, right? Depending on their skin. This is like pharmaceutical grade.
It is.
This is
strong.
not something you can get.
No, you cannot purchase this just over the counter
or anything close.
No.
No.
There's some lines at Sephora that are in the back that are really physician grade, but it's not something that they can cause irritation. They're fruit acid products, so they can cause
so you have to be
irritation
careful, and they have to be prescribed or at least supervised.
Correct.
So you tell people what exact products to use based on looking at their skin.
Yes, and I have a website where people can go and find information, and you can always email me directly from the website, and I can answer questions online.
I think that's absolutely wonderful. One of the things we talked about before the show is that you're working in the community to help preserve Belle Isle. If any of you haven't been to Belle Isle recently, it is the most beautiful place on the planet, and it is so immaculate. Oh my God, it rivals Central Park now.
It
I
does.
swear to God. So tell me about that project for you.
Well, I participate with the Belle Isle Conservancy, which and in the past was the Belle Isle Women's Committee. But we have events on the island to raise money to do specific projects on the island. So over the years, we've done things like purchase new sand for the beach, improve the restrooms, things such as that. And this
That's
year,
a good thing.
Great. And they're very practical products, which is what I like. I like to see a difference made in the community. And this year, our project will be to create a discovery playground. So these are scientifically based playgrounds to improve and educate the lives of our children. We're working with the Department of Natural Resources to begin the plans for discovery playgrounds around the island. So this will be a 3 to 5 year project of ours. But we have an event on October 8th.
Okay.
It's a hat luncheon for women.
Oh, how wonderful. Is it on the
I'd
island?
love for you to come. It's on the island at the Belle Isle Casino.
Oh, the casino is renovated. It's
Yes.
fabulous in there. Okay.
And so we'll have it there, and then the funds will go towards creating these discovery playgrounds for the island.
Oh, I think that's wonderful. So for those of you who are interested in keeping Belle Isle healthy, which is a good thing, getting out, one of the things we talked about before the show was the fact that Detroit is known for automotive culture. It's getting a burgeoning art and sort of music, certainly a large music culture. But Detroit isn't known for a beauty culture. But, you know, I'm a big beauty junkie. I know this one sitting across from me is a huge beauty junkie. Do you think Detroit is ripe for a beauty movement? How come people don't talk about Detroit and beauty? I think it's a place people have a lot going on here, and they're obsessed with it. We're not the only two.
No, we're not. And I think because we've always been known as an industrial town, that's one reason people don't associate an industry with beauty, but they absolutely can be one and the same. And I think the fashion industry that's coming to Detroit now, it also helps.
Okay.
And so we're a place where, as we were talking earlier, many of the magazines never feature dermatologists or salon owners or people such as that from Detroit. It's always Atlanta or LA or DC or New York.
DC or Chicago.
Or Chicago, but we absolutely do have a culture of beauty here where people focus on skin health and wellness and beauty, both from the makeup side, in the movie industry, hair side, and fashion.
So it's really the fashion. You think the fashion is going to bring the beauty?
I do.
That's how it'll come?
I think that's how it's going to come. I know the Detroit Historical Society is going to be having an event soon with a designer here. I think that's really the part that's going to start pulling back the beauty industry back into
Are they
Detroit.
that intertwined? A little bit?
I believe so. I think the fashion, I think the movie industry. I think those are the things that are going to start pulling the beauty industry back into Detroit.
Yeah, well, I think I think that's true. I think Detroit has a really burgeoning community of a lot of people that are going to bubble up from underneath, and we're going to see more and more.
So as an example, my office, Cosmetic Dermatology, we're also sponsoring the Charles H. Wright Museum's upcoming event, which is their 50th anniversary gala. But they're going to be celebrating a fashion fair. And
well, that's all about beauty.
And the models who've
Are
been
you
a part
kidding?
of that industry all of these
When
years.
is that event?
It is October 10th.
Oh, so it's the big fundraiser.
It's the big fundraiser
for the museum. Oh,
for the
that's
museum.
wonderful. Well, that
So
is
they're
all about
celebrating
beauty.
fashion as a part of that, and that's a wonderful example of how
That
the
is
beauty
a
industry and fashion are
perfect
coming back.
example of how Detroit is embracing health, beauty, and wellness.
Ebony Fashion Fair. All the models will be there. It's going to be wonderful.
I think that's great. Oh, it has been absolutely a pleasure. Thank you so much, SHAUNA RYDER DIGGS, dermatologist, entrepreneur, regent at the University of Michigan, and fellow skin junkie.
Thank you for having me. I appreciate it so much.
Thank you so much. As always, thank you for tuning in to Detroit Nation Radio. Follow us on Instagram, Facebook, and Twitter at 313 Nation Radio. And remember, achieve your personal best, then beat it. See you next week.